This conference will now be recorded.
All right. Hi, everyone. Good morning and good afternoon, wherever you are. And I hope you're having a very pleasant day and a good Saturday. So hopefully, once we're done with this session, you can go on and have a nice weekend. So what today's session is, if you don't know me already, my name is Dr. Bhavna Sharma. I work as a medical registrar in NHS London. And after completing my MRCP, I'm now specializing in endocrinology. This is going to be a session on OET writing. Now, what I'll do today is we've done a cheat sheet which mainly focused on introduction and the conclusion as to what you can write when you're writing your actual letter. You're able to organize your letter into a nice introduction and a nice conclusion to just end the letter. I've seen a lot of people that have tried to check, and we've had our English teachers and other doctors also check letters. We found that even though people are now, they've improved in writing their introduction and their conclusion, we still have a lot of people making mistakes in the middle paragraphs. So similar to the things that we did before, that we organized our thoughts into cheat sheets which were grammatically correct, we're going to do that same thing. Now just the focus will be on the middle paragraphs, which are actually quite difficult because you are able to cut, copy, paste introduction and conclusions on most type of letters, but the middle paragraphs are a little bit tricky because they vary in their content. So sometimes you might have a nurse writing a referral letter to a specialist, or sometimes it might be a specialist who's been seeing this patient for a long period of time but would now like to seek a second opinion. So the history and the presentation of the patient can vary quite a lot, and that's what makes middle paragraphs a bit difficult. So hopefully after today we should be able to improve on our middle paragraphs. Now guys, what I've done today is I'm going to be only concentrating on expanding the history of the patient into as in paraphrasing the case notes of the history into proper sentences. Next week, what I'll do is we'll talk about examination and how we can expand examination into appropriate sentences. So make sure that once you've attended this session, you enroll for the next week's session as well. Like always, this is going to be uploaded on YouTube. So if you miss anything, you should be sorted. But it's always better to do things live because then you're able to ask questions and get your answers corrected. Okay, so a very quick revision. I hope everyone remembers this from before. On your OET, you're actually checked on 4 basic things besides everything else, which is that you should have a proper format to your letter. So you have to have a proper introduction, and then you're going to have the middle paragraphs, and then you have to have a proper conclusion. Clarity and content, you only include information which is important to the audience that you're writing the letter to, and obviously you're graded on language. I hope everyone remembers that. Guys, if you have any problems in the difference in between clarity and content and how you're assessed on formatting and what the basic organization of an OET letter should be. If you understand all of that, please type in yes, because it's quite important when we cover the organization of middle paragraphs. So please type in yes if you understand the concept. Okay, that's good. So let's talk about middle paragraphs and how we should organize them. Lots of students do ask us, Ibe has just asked, Ibe, they've written that I don't understand, please. So Ibe, can you just let me know what exactly you don't understand in that so that I can explain it for the benefit of everyone else as well? Okay. While we're waiting for Ibe to answer, the first thing that we're going to concentrate on when we're talking about middle paragraphs is when we have a case note which has got a number of visits. So guys, you get this quite a lot on your actual OET exam, is that you'll have a patient who's been coming to you for a number of visits. So they'll have they came in on this date with something, then they came in on the next date with another thing, they came in on the third date with another thing, and on the fourth day with another thing. So lots of students, they do struggle with trying to figure out how to organize these multiple visits into a coherent paragraph which tells a story to your audience, and it provides them with all the information they need to continue to care for their patient. We have discussed this in our previous sessions as well. So if you're still confused, if you go to our YouTube channel and you search for audience awareness and you search for specialist referrals and the types of letters, you should be able to get clarified on the point that each specialist has a specific history that's going to be pertinent to them. So the main thing that you need to understand about multiple visits is that you have to include those visits with the specific history or the specific examination which is going to affect your patient's care and which is going to affect the way that the specialist is going to take care of the patient. For example, if you're writing to a psychiatrist, you're going to include all the history which is going to be pertinent to the psychiatrist. If you're writing a letter to the surgeon, you're going to include all the history or all the examination or investigations which is going to be pertinent to that surgeon. In case of multiple visits, you have to include, according to the official OET, you have to include the first and the last visit that the patient came to you with. This is with regards to the official OET guidelines. Now, if you have any visits in between, you're going to be including specialist specific information. Okay, so the first visit, how are you going to write the first visit? Let's try and do a cheat sheet on that. Okay, so you've decided, you've got your letter, you've decided that, okay, this is my audience. You're going to use the Teachio method. You're going to go to the purpose, underline the purpose, identify who your audience is, and then you've highlighted whatever case notes you want to include. You have to include the first visit. How are you going to write that? You're going to write things like, Mr. Smith first presented to our practice on 27th October 2009. So you can also write it as on the 27th October 2009. That might be slightly better, but this is also fine. So the first visit is going to be written like that. There is a variation of this. You can also write, Miss Jones first visited our hospital in 2011. So guys, you don't write in the 2011. You always write, if there's just an year which they came to you in, then you write in 2011 with new onset of whatever symptoms they had. You can also write, if the patient has been in your clinic for a number of times, so they might say that patient has been following up in your clinic for about 5 years. You can write that as Miss Jones has been known to our clinic since the past 5 years. Now, the way that I've written 5, you should always write that in the form of F-I-V-E. You shouldn't write 5 as a numerical letter. It's not completely wrong, but just to maximize everything, make sure that you write F-I-V-E rather than numerical 5. So that's your cheat sheet for the first line that you're going to write, which is going to be the first visit, first presented, first visited, has been known. The mistakes that people do are not writing the whole thing. So you should always write, in order to look quite professional, you should write 27th and then there's a TH after that. October, the whole thing. Remember, O is capital because we're talking about a month. So O is capital and then 2009. Okay. If you're talking about a year, you're going to write in 2011, not at, not anything else, in 2011. Okay, so that's going to be a cheat sheet for the first line. Guys, just take a screenshot of this and then we can move on. So Faisal has asked, so we will add the subtitle first visit as well. No, Faisal, you will not do that. That just means that you're going to be talking about the first visit in the beginning of your middle paragraph. You don't have to write first visit. Okay, so that's going to be your first line. What are you going to write after that? After that, you're going to include the specialty specific information. You've written the first thing, you've written the first line, and then you're going to write the middle visits, or you've included the first visit. Now we're going to talk about the middle visits, and in those visits you're going to include specialty specific information. Amy, October, the O has to be capital. I won't really worry about the number of words because, as I said, the number of words is more suggestive on the OET writing, and it doesn't make a difference if you go 2 words over. It's just that your language looks quite better when you write the whole thing. Okay? It looks more professional. But remember, the O has to be capital. Okay. Then how do you include information which is specialty specific? A cheat sheet for that. After her first presentation, Miss Jones has had recurrent visits with similar complaints. So if the patient has come to you with abdominal pain, so Miss Jones first came to our practice on the 27th of October 2019 with complaints of abdominal pain, full stop. After her first presentation, Miss Jones has had recurrent visits with similar complaints. She came to our practice again on 13th January 2013, complaining of whatever complaints she came to you with. So perhaps she came in with nausea and vomiting associated with the abdominal pain. Miss Jones has been regularly attending our clinic for ongoing complaints of intractable symptoms of. So a very good word that you can use on your OET writing is intractable. What does intractable mean? Intractable basically means when a patient keeps having symptoms which don't really resolve with treatment. So try and learn this new word today. Use it on your OET writing. It might be quite useful. Okay, so the cheat sheet or the mistakes that people make is after her first presentation, Miss Jones has had recurrent visits. Okay, because the visits have been having, so it's has had recurrent visits. Miss Jones has been regularly attending our clinic. Okay, so has been, because she has been doing it for a period of time. So has been regularly attending our clinic. Okay, guys, always it's complaints, it's not complaint, because when you're writing about a patient's symptoms, they're always multiple rather than one. So for ongoing complaints of rather than ongoing complaint of, it's just a little better. Okay. If you've understood the first line and the specialty specific information, then we can move on. Otherwise, if anyone has any doubts, just let us know and then we can solve them, or we'll move on. Yes, you're right, user. You should write since the past 5 years. Okay, let's move on. Now, you might have a patient who came in with some are complaints of. Okay, so complaints is a noun. That's why it's complaints of. Complain is a verb. Okay, so you complain, I complain. Okay, so if you want to write that she had a particular complaint and you want to express that as a verb, you can say that Miss Jones has been complaining of, or Miss Jones is complaining of. Okay. Now, sometimes this does happen on your OET writing a lot, that you might have a patient who came in with a visit where you found lots of things. So how do you write that? You write that as on the 15th June 2018, comma, Miss Jones, so M is capital, J is capital, came to our clinic again with whatever symptoms she came with. She complained of, so Summer, do you see that? We've expressed that as a verb. Then you can write about management. A very good way of writing about management is she was managed conservatively with analgesia and whatever you did. Guys, conservative management for the purpose of the OET, or even when you come and work here, conservative management means medically managing things rather than doing a surgery or rather than doing anything very, very extreme. So, very good method if a patient comes to you with certain complaints and you just give them a paracetamol, or you just reassure them, then you can write she was managed conservatively with. So it's if you're managing something, you always manage with. That's the connector you use. With analgesia and reassurance. She was advised, and then whenever you advise someone, it's always an S, it's never a C, and then you write advise to. So you always advise someone to do something, so you always have to write TO. A follow-up visit was arranged for her. So we're using the passive voice here. We're trying to show the OET examiners that our English is very, very nice. We're able to use passive voice as well. So we use this cheat sheet. We write a follow-up visit was arranged for her for the following week. Okay, don't write next week, because next week might mean when you're writing the letter the week after that. The follow-up visit was arranged from the 15th of June. Okay, so you have to write for the following week. Very nice way of writing that. If the patient didn't respond to your treatment, you can write despite the above, comma, her symptoms did not improve. Her symptoms, or sometimes what might happen is that your treatment did help a little, so you can write her symptoms did get better in the interim before recurring on. So when you're talking about something which happened, but then it sort of reversed. For example, in this lady's case, you gave her treatment and the treatment worked for a little bit of a time, but then it got bad again. A very good way of writing that is her symptoms did get better in the interim, so in between or in the interval. So another good piece of phrase that you can use on your OET writing, in the interim. In the interim means just in between a period of time. So for a short period of time, in the interim, her symptoms got better before recurring. So look at that sentence, not reoccurring. Some people do write that. It should be recurring on whatever. So SD, you can write a follow-up visit was arranged for her after 1 week. So that sounds a little awkward, so they might not really understand. I would suggest writing following week. So Yash is asked something which might be appropriate for SD's, the word that she used. What you can write is, Yash, you can write a follow-up visit was arranged for her for the next, what you can write is after 4 weeks, like ST mentioned. So yes, you write a follow-up visit was arranged for her after 4 weeks following this visit. You understand that, Yash? Just type in yes if you do. Okay, excellent. So despite the above, her symptoms did not improve, or her symptoms did get better in the interim before recurring on. Notice that we've just talked about the symptom that the patient had, because that was the reason why this patient is getting referred to the specialist. So we're only talking about the pertinent visits and the pertinent information which is going to be appropriate for your specialist. Now, once we've done the first visit, we've done a cheat sheet for the first visit, then we've done a cheat sheet for the pertinent information from the middle visits. Now we have to talk about the last visit. So a cheat sheet for that. User, I would try and avoid return visit. Okay, so how do we write the last visit? Today, comma, Mrs. Jones has again come to our practice with worsening signs and symptoms. She has not responded to the treatments provided appropriately. She has also developed new complaints of. Guys, you can actually copy this sentence and it's applicable to most visits that the patient might come in with. You don't even need to change this sentence. So you can take a screenshot of this if you want. So what you write is, today, Miss Jones has again come. Because we're talking about past tense and we're talking about a very recent past tense. So it's going to be, Mrs. Jones has again come to our practice with worsening signs and symptoms. Another way that you can write this is that at the time of writing this letter, Miss Smith has had intractable signs and symptoms necessitating an urgent referral. She again came to our practice on 12th of August 2019 with symptoms of. So you always have to write about the last visit. Why do you have to write about the last visit? Because you were seeing this patient for a number of times, but then something did happen on the last visit which prompted your referral. So it's very important for the specialist to know why exactly the referral was done. Two sentences which you can use are the first one, today, Miss Jones has again come to our practice, or at the time of writing this letter, Miss Smith has had intractable symptoms and signs necessitating an urgent referral. So, Taboya, that's fine. A follow-up visit was arranged for her in the next 4 weeks, you can write, or in 4 weeks is also right. Today, so SD, you should write, today, comma, so ST, because it's a person's name or their surname, you always write the S capital. Today, Mrs. Smith's condition has worsened. Okay, that's a better way to write it. Always has on the last visit. ST, if you've understood that, please type in yes and then we can move on. Excellent. So that was how you write multiple visits on the OET writing. Guys, if you've understood that, please type in yes, and then I'll try and talk about history of presenting illness and how we use that and how do we elaborate a history of presenting illness on the OET writing. Okay, very good. Now we're going to talk about history of presenting illness. Now, all of the people here are doctors and nurses who are already quite experienced in medicine. So you've done this a number of times. A patient comes to you with a certain complaint. You always take the history of presenting complaint. So that's basic history taking. But what do people often get trouble with is that the history of presenting illness has got a number of things in it, all of which require specific English and specific connectors and specific sentences. So what we'll do, we'll break down what you see on the screen as a basic history of presenting illness, which everyone knows till now. We're just going to see how we use appropriate sentences and appropriate connectors when we're talking about a patient's history of presenting illness. So everyone knows this. History of present illness, you ask them how long they've had the condition for, how did the condition start, how has the condition been since starting, is there anything which makes the condition better, is there anything which makes the condition worse. That's your basic history taking. Now, how are we going to write this? The cheat sheet, when you're talking about a patient's duration of illness. Miss Johnson's symptoms first started 3 months ago. Another way of writing that is Miss Smith first described, so it should be Mr. Smith first described his signs and symptoms about 5 years ago. Or Mr. Gomes has been having on and off symptoms of abdominal cramps since the last 13 months. So this is the way that you're going to talk about a patient's duration of illness. Sometimes you might get children or you might get someone who's got a long-standing illness or they've got a congenital disorder that they've been diagnosed with. When you're talking about that, you can write that as at the age of 6 years, comma, Timmy was diagnosed with autism spectrum disorder. So guys, you always get diagnosed with, and that's why you write it. But if you're talking about a congenital disorder and it being diagnosed at a certain age, you have to write it like that, at the age of 6 years. So always the 6 doesn't have to be numerical necessarily. I would advise writing SIX. Okay, so this is how we write the duration of history of presenting complaints. How do we talk about the mode of onset? Cheat sheet for that. Miss Jackson stated that her symptoms began insidiously. A small quiz. Does someone know what insidiously means? Please type into the chat window. And this is a very good word that we can actually add onto our vocabulary when we're writing on the OET writing. And even when you come and work in the NHS, when you're writing. So, Yash, the actual meaning is, so insidiously basically means that it the symptoms begin without them knowing that they've started. It's a gradual onset. Amy is right. They're not really sure when the symptoms started and they've been developing gradually. So usually, if we're talking medical, cancer symptoms can sometimes begin insidiously. So the patient starts developing weight loss, but they don't really notice it. And then they start seeing that their clothes are getting a little loose, but there's no abrupt onset of weight loss. And that's the way we describe insidious symptoms. So good word that you can use on your OET writing. Mr. Tomlinson feels that his symptoms began rather abruptly. So the opposite of that, insidiously and rather abruptly. So very good word that you can use with abruptly is rather abruptly. That basically means that the symptoms started a little fast. Sometimes the patient might describe a sudden onset of symptoms, and that's how you write it. Miss Walson described a sudden onset of palpitations. So user, I would rather write past 13 months rather than last 13 months, but both of them are fine. Okay, so that's your cheat sheet for how you describe a mode of onset. So began insidiously, began rather abruptly, described a sudden onset. So a sudden onset of. So that's the whole phrase you have to use. The way that the patient is going to tell you about the symptoms, you can use all the three variations: stated, feels or felt, and described. Okay. Course of illness. Now, the patient might tell you that the disease has gone up or down, or this disease has been progressing. How do you write that? Over the past 20 years. So if you're talking about the patient having a symptom over a period of time, you write that as over the past 20 years, comma, Mrs. Young has been having on and off episodes of intermittent headaches. So you can either write intermittent headache or headaches. Okay. But if someone comes to you, they never come in with headaches, they come in with headache. Okay. Ikra, this is for both. Since the past 12 months, Mrs. Young's symptoms have been gradually worsening. Okay. So when you're talking about something getting worse, you write have been gradually worsening. It's an ing there, not worsened. Lots of people make that mistake. Mrs. Jones has had a fluctuating course. So when you're talking about somebody's course of illness, you always write that as a fluctuating course. So a fluctuating course of erratic blood sugar control over the past 17 years. So Faisal, if you write episodes of headache, then that's right, or just headaches, that's also right. Sumit, I didn't really understand which sentence you're talking about. If you can just describe that, then I can answer your question. Okay, so Sumit has asked, since the past 12 months, Mrs. Young's symptoms have been. So, Sumit, when you have a plural, that's with a have. So, symptoms have. If there's one symptom, then that would be has. So, I have, you have, he has, they have. Okay. So, when it's plural, then that's a have. When it's singular, then that's a has with an S. Sumit, if you've understood that, please type in yes. It is actually quite important to know. Mr. Manoj did cover this in our previous session. So if you're still confused about have been and has been, please just watch that session. It's still on YouTube. Okay. So that's how you describe the course of illness. Now, describing pain. Guys, we've discussed a little bit about history of presenting complaints and how we would use the cheat sheet. Now we're talking about describing pain on the OET writing and a cheat sheet for describing pain. If you've understood the history of presenting complaints, please type in yes and then we can move on. Yes, Amy, that's fine. Mrs. Young has been having intermittent, the spelling of intermittent is wrong, episodes of headache and then full stop. Guys, if you've understood about history of presenting complaints, please type in yes and then we'll talk about pain. Okay, so I have included pain because I think it's very, very important on OET writing and something that a lot of students do struggle with, which is describing pain, because it's got a lot of components to it and each component has got a different grammar attached to it, which often becomes quite painful for students. So I've tried to cover that through this session. Again, going a little bit medical. When you describe somebody's pain, people might remember the mnemonic of Socrates, which is basically that when you're talking about somebody's pain, you have to ask about the site of pain. So where is the pain? Onset of pain. What were they doing when the pain started? Character of pain. What does the pain feel like to the patient? Radiation of the pain. Does the pain go anywhere else? So there's a little bit, there's radiation and there's shifting. We'll talk about that as well, how we write that on OET writing. Associated symptoms, time and duration, exacerbating relieving factors, does anything make the pain better or worse, and severity of pain. So how do we write all of this thing on the OET writing? Let's discuss that. Onset of or duration of the pain. So this is similar to the history of presenting complaints that we talked about. Mr. Jones stated that the pain started about 2 to 3 months ago. Guys, instead of writing 2 to 3, I would prefer that you expand that into 2. So TWO and then space TO space THRE. That's a better way of writing this. But remember, when you're talking about an approximation, so the pain, the patient told you that the pain might have started 2 months ago or 3 months ago, I'm not really sure. You write that as the pain started about. So about means that the patient isn't sure when exactly the pain started. So they've given you an approximation. So when you write an approximation, you use about 2 to 3 months ago. You can also write approximately 2 to 3 months ago. That's also a good way of writing that. And what does the patient tell you about the onset of pain? He said that the pain started all of a sudden whilst he was bending to pick up a heavy object. Okay, so whilst is also a good word that you can use on your OET writing, which means that they got the pain when they were doing something or during the duration of doing something. Vinci, you can write around 2 to 3 months as well. Okay. Another way of writing this is that Miss Smith stated that the pain began about 7 months ago. She reported, another way of writing about a patient's history, she reported that the onset of pain has been gradual. She reported that there was no obvious precipitating factor for the pain. So if the patient tells you that I'm not really sure, the pain started quite gradually and there's nothing which brought the pain about and it just started out of the blue, then you can write that in a very nice way by saying that she reported that there was no obvious precipitating factor for the pain. Okay, remember guys, we're using the a lot here because we're talking about a particular pain that the patient has, which you're trying to describe to the specialist. You're not going to be writing a pain, okay, because we're talking about something in specific. That's why it has to be the pain. Okay. Site of pain. How do you talk about where a patient's pain is located? Miss Jones described the pain as being localized to her upper abdomen. So when you're talking about a patient having a pain in a certain area, a good way of writing that is Miss Jones described the pain as being localized to her. Okay, to when somebody's pain is being localized, the connector we use is to her upper abdomen, not in her upper abdomen. Mr. Smith localized his pain to mainly the suprapubic region. Mr. Johnson's pain was primarily located in the upper back. So 3 variations. How you can do a cheat sheet for describing the site of a patient's pain, localized to, primarily located. Benita, you should write localized to. That's the best way. All right. So guys, if you've understood how we describe the site of pain, then we can move on to the other parts. Please type in yes if we should move on. Okay, excellent. Character. Now the patient always tells you. So Amy, you don't know where the patient's pain was. The patient told you that their pain is there. Okay. So you should always write that the patient told you that the pain was somewhere. Okay. You can write, so at the scapular region is a little vague. Because there is no particular region on the scapula which you can talk about as at the scapular region. Because it's a region, it is a large area, you should be writing around the scapular region. Okay, because it's a large area, the scapula is a large shoulder bone, so you describe that as around the scapular region. Vignesh, you can use while as well, but whilst is a more advanced word, so you might score a little more marks if you do that. Okay. All right. Now, the patient always describes things to you, so they describe the pain. Zen in the upper back is also fine. The patient always describes the character of the pain: sharp, stinging, cramping, dull. So you always, when you're talking about a character of a pain, you use Mr. Holmes described the pain as, or Mr. Gomez characterized the pain to be. Okay, so described is always as and characterized the pain to be. Okay, just memorize that. Those are the connectors that you have to use. And then you talk about the patient's description. So, Mr. Holmes described the pain as sharp and stinging. Now, sometimes the patients might give you some words which aren't really proper English, or they're not really proper descriptions, like Mr. Holmes did. He said that he felt as if 1,000 bees were stinging him at once. So when a patient gives you that type of a phrase and you want to include that, you always include that in quotes because you're describing the patient's language. Remember that, that's very important. Mr. Gomez characterized the pain to be dull and cramping in nature. So whenever a patient is describing a pain or the character of the pain, you use these cheat sheets. Radiation, this is very important. Or most students, they make mistakes on this. Mr. Johnson felt that the pain radiated from his back into his left leg. Okay, from the back into his left leg is also fine. Miss Smith stated that the pain started around her umbilicus and then gradually shifted into her right lower abdomen. So that's another way that you should be able to write about radiation. But the things that you need to remember is that it's always radiation into or radiated to. Into is a slightly better word, but it always has to be radiated into or to. Or Miss Smith stated that the pain started around wherever and then gradually shifted into her right lower abdomen. Okay. Now the patient might describe some things which make the pain better and some things which make the pain worse. How do you write that? Miss Fade found that her pain was relieved by peppermint tea. So found that her pain was relieved by. She also stated that her pain was worsened by hot and spicy foods. Mr. Kingsley stated that his pain was relieved by codeine, but worsened by ibuprofen, because something makes the pain better, something makes it worse. So if you want to connect the two, the connector that you use is but, because they're two opposite things. Another thing that people do struggle with is the severity of pain. So a cheat sheet for that. When asked to rate her pain on a scale of 1 to 10, Mr. Hickson stated that his pain was 8 out of 10 at its worst. So you can also expand that into 8 EIGHT out of 10. Miss Abel rated the pain as 10 out of 10 in severity. She also said that with analgesia, the severity of pain reduced to 3 out of 10. So guys, please take a screenshot of this. Everyone makes a mistake on this. I don't want anyone to make a mistake on severity again. This does appear on your OET writing a lot. So I don't want any of the students who attended the session today to make that mistake again. So make sure that you take a screenshot of this. Okay. So that was the end of today's session. I've actually finished in time today, so that's an achievement. I hope you guys learned something new today. If you have any questions, please type in into the chat window. He was advised with lifestyle changes. Is it correct? So user, we're going to be talking about management in our next lecture. So hold that thought, but it should be that he was advised with lifestyle changes, not with the lifestyle changes. Can we use, however, in the second paragraph, however, the pain had reduced, not had reduced, it should be was reduced after taking analgesia. Okay, so that was the end of our session today. Guys, if you have your exams coming up quite soon, I would sincerely advise that you do take advantage of the Teachio writing and speaking checks. We've had lots of positive feedback from the students who've been giving our writing and speaking check, and we've actually seen improvement. Amy, the group discount booking is for throughout the world. So if you just text Dr. Prashant on the number provided, it's a WhatsApp number from the UK. That might confuse you, but we do bookings for all over the world. So please text Dr. Prashant if you're interested in group discount. It actually brings down your exam fees by about 30%. So that's a very good saving. Text the number on the screen or text Dr. Prashant on the number that I've given you. Sumit, we do provide case notes which are new for writing correction, and we make sure that the level of case note that you receive is appropriate for your needs. So it's customized according to your requirements. So if you're interested in them, please type into the please text the number provided or text Dr. Prashant. So Amy, our sessions on Saturday and Sunday are completely free. If you're interested in group bookings, please text Dr. Prashant. Thank you, Faisal, if you found it time saving. I hope you do quite well on your exam. I know that you've been attending quite regularly, and I hope it's going to improve your score. But guys, if you're interested in writing check and speaking check, please visit our YouTube channel, www.teachioacademy.com. Binsi, if you go to our YouTube channel, you should be able to find the videos on optimizing your scores on reading. And I've tried to break it down into strategies for reading for part A, part B, and part C. If you guys are interested in starting to prepare for your PLAB 1 exam, we've also started uploading YouTube videos. So that should start preparing you for your PLAB 1 as well. All right. So that was it, guys. I hope you've had fun today, and I hope you've learned something which is new, and it's going to increase your score, and hopefully it makes you a little more confident. Next session that I do the next Saturday is going to be on examination and management cheat sheet for middle paragraphs. So make sure that you join it. If you are a part of our Telegram group, or if you're a part of our WhatsApp groups, you should receive notifications as to what the group meeting ID would be. But make sure, guys, you do join. It's always better to do live sessions rather than see them. But I hope you've learned something new today, and I hope you guys keep healthy and you keep doing well and keep studying. But just have a nice weekend, relax a little bit, and I'll see you on the next one.